Okay, ladies and gentlemen, right now we are recording. Okay, introduction to CHAS, or setting preferences for Carepoint Healthcare Application Suite. Okay, purpose of this session is overview of getting started within the CHAS application, registering and setting up preference. Okay, upon completion of this lesson, the student should be able to state the purpose of CHAS and register and set up preferences within CHAS. Okay, on previous CHAS session, they did discuss the following points. The purpose of CHAS Suite, the main features of CHAS and MHS Population Health Portal, identify the differences between CHAS and MHS PHP, state the CHAS applications and their uses, define the CHAS applications, compare the CHAS application to the user roles between provider, nurse, and medtech, and general manager, identify the CHS security keys required by the users to have a CHAS application or CHAS account. And last but not least, I will demonstrate the functionality of some of the CHAS applications during preference setup. Okay, let's talk about CHAS. It's used by medical professionals to access data, specifically last name, first name, age, diagnosis, meds, labs, and RADs. And being able to pull all that data together in one user-friendly integrated environment, specifically in front of the desktop without having to open too many windows. Okay, it is based on CHS security keys, so therefore anybody who applies for a CHAS account needs a CHS account with their security keys, whether it be a provider, a nurse, a medtech, or a general manager. Okay, and by having those security keys within CHAS, the user can set up the personal preference on how they want to view the information. Okay, CHAS collects lots of data from the CHS patient data. There again, last name, first name, social, address, phone number, diagnosis, meds, labs, and RADs, and aggregates all that data into a healthcare information view, so that way healthcare providers can manage and improve patient care at their MTS. CHAS also transmits data to CHCS and also to cohort, composite, occupation, health, operation, risk tracking. Okay? And it provides a consolidated view of the data for its users. Sometimes CHAS can be called data mining. Okay, let's talk about the main features of CHAS. Yes, it's a web browser application, which means you can access CHAS through the internet. Yes, it's based on your CHCS provider keys, nurse, provider, medtech, or general administrator. Yes, it has a lot of applications which aggregate data, which whatever units of data you require. And yes, you can do some reporting, CAN and ad hoc. But CHAS is not a data entry tool or reporting tool. You can access information, and there's an exception to that last line, is the dysplasia patient tracking. Dysplasia patient tracking module can look up pap smears, and you can note within the patient's encounter, positive, negative, no result, and also you can send out letters to inform them of the results and or upcoming appointments. But remember this, data flows from CHCS to CHAS, not the other way around. So that means when you note whatever the pap smears are in DPT, they will not show up in CHCS. Okay, and this is what we're going to cover today. Registering with the CHAS portal, setting applications, mapping permissions, personalizing the dashboard, and searching for patients. Okay, this is the CHAS portal. And this is what it looks like. If you look in the upper left-hand corner of my slide, it says Lackland Air Force Base. All CHAS portals are specific to their MTS. West Point, Fort Lewis, Fort Polk, Fort Carson, all CHAS portals are specific to their own MTS. So that means if you're stationed in West Point, you cannot apply for an account with Fort Lewis. Now, when we go to the ACE portal, I'm going to show you how to get into the links and go to a specific MTF. Okay, at this time, are there any questions? All right, what I'm going to do right now is I am going to show you a quick video, and then I'm going to do a demonstration on the CHAS portal. Okay, right now, my notional instructor is going to walk us through the process of how to register. As you see by the blue term here in front, it says you must have a CHCS account with the proper security keys prior to registering for a CHAS account. Now my notional instructor is going to click on the register button, and it's going to go to the register for portal access. It will ask you, do you have a valid CHCS account? At this time we're going to say no, due to the fact that the applications have not been selected in CHAS. Now we go to the register for portal access. My instructor, Mr. Keith, is going to fill out all information within the boxes. The red asterisk terms, data is required. And if you do not know what your password requirements are, bottom right hand corner, there's a password requirement tab, and you can click on it and it will let you know. After all information has been inputted, Mr. Keith is going to click on a submit registration button. And when you click on the submit registration button, you should hear within 24 hours in your email with a username and password. Okay, my view has just changed to the HIPAA Privacy Act agreement. Mr. Keith is going to click OK. And it's going to take you to the CHAS website. Now, Mr. Keith is showing us that Carepoint Help Desk contact number and also Carepoint frequently asked questions. At this time, Mr. Keith is going to go ahead and log in with his username and password in the portal login password section. He's put in his username and password. He will click on login. Now on this, he's going to change, and on this web page, he's going to click on the continue button. And now we are logged in. Now one of the first things a new user needs to do is update their profile. So Mr. Keith is going to go upper left hand corner, click account and my profile. And this is Mr. Keith's profile information. He's going to go to the bottom left hand corner, click on edit, and he's going to update all this information. At this time, he can register his CAC card by clicking on the register CAC button on the upper right hand corner. And once he's done with that, he will go down to the update button, bottom left hand corner, and click on update. And Mr. Keith is going to go ahead and do that. Now, we've completed the request registration, and logging in portion. At this time, any questions on what we just did? Okay, I'm going to go ahead and, all right, let's go to the next slide. We're going to do a demonstration. Okay, and this is my CHAS training site. At this time, I'm going to HIPAA Privacy Act Agreement. I'm going to click OK. And you notice that this is a Lackland Air Force Base portal. And this is my training site. So at this time, I'm going to go ahead and log in. I put in my username and password. I'm logging in. And I'm going to click on my continue button. Let me take a moment to explain these two boxes. The useful alert information box is to remind you that what's going on in the system, updates, changes, and this is for your information. Also, you can also track how many successful and unsuccessful login notifications you get. I'm going to click on continue. My web page is thinking. And this is my user account. Now you notice that my account is already set up, but I'm going to go through the motions again to my account, my profile, and my user profile is already loaded. There again, if I want to go ahead and edit, I will click on the edit button and edit my user profile name, update it. Also at this time I can register my CAT card. And then once I'm done, I can click on update. But for training purposes, I'm going to click cancel. Okay, next portion of the CHAS application we'll talk about is applications. Applications are those units, modules, widgets, whatever you want to call them, that help the user, being a provider, nurse, or medtech, access patient information, whether it be lab, rads, appointments, emergency room. My notional instructor here will assist me on how to do that. Mr. Keith is going to log in, hit the continue button. Now he's going to go to my account, application library, and you notice under application library he has all these add buttons on the ICDB column and what the application is on the right hand side. Now you're going to notice that Mr. Keith had highlighted add, and he's going to select a few applications. Now, if I want to know what the application does and what the security keys require, I'm going to click on the little blue More button, and it will tell me what it is, what does it do, and what CHAS security keys are required. Now, be aware that If any security key in CHCS system starts with a KW, that is a CHAS application. My summer course catalog advertisement. All right, now what Mr. Keith's going to do is going to click on the refresh menu bar, bottom right hand corner of my screen. And then he's going to go up to apps. And all those applications he added, you can see them now. And Mr. Keith right now is going to remind me that I can either remove or add more applications just by clicking on the remove or add buttons. Alright, I'm going to do the same thing. I'm going to go directly to my account, my application library. And now switch into my application library. Now, on this view, you notice it's the same thing that happened on my video. That in the ICDB column, I have all the add, remove buttons. So now what I'm going to do, I'm going to remove some applications. My complete TCONs, I'm going to remove. My DPT, dysplasia patient tracking, I'm going to remove. My peer review, I'm going to remove. I'm going to remove my referrals from me. Now, that's what I'm going to do. I'm going to go to the bottom right-hand corner and click my refresh menu bar. When I go to my apps tab, and you notice that those items that I removed are no longer there. So I'm going to go back to my screen. I'm say, okay, I want my DPT, dysplasia patient tracking. I want my peer review tracking. And I want my referrals from me. Go back to my bottom right hand corner. Hit my refresh menu bar. And I go to my apps button, and those items that I just added back to my list are showing. Okay. All right. We're going on to another portion or another module of CHAS. And it's called mapping permissions. What mapping permission does for a user is that it takes all his CHCS, his ICDB accounts, however many they have, and puts them in one screen. That's what we call single sign-on capability for CHAS. And that is a great item for a user that has too many applications under one ICDB or too many applications in CHCS. My notional instructor, Mr. Keith, is going to go ahead and demonstrate for us. And he's going to go in the upper left-hand corner and click on the apps. And he's going to click on the appointment module. Okay, now once he goes in there, you notice there's a little section called password login, as Mr. Keith highlights. What he's going to use is a CHCS account, username, and login password. And once he clicks login, and it's only a one-shot deal, so every time he logs into CHAS, his CHCS account will show up within the appointments section of his appointments module. And he can access all the appointments that are done within CHCS. It's that simple. Okay, at this time I'm going to demonstrate the same thing. Go to my apps, go to appointment, Now you notice that I do not have that little same section within my module due to the fact that this is a training environment, so it is not connected to a live database, but that's how you would do it. And here you can also look up for appointments, look up for patients' names. Okay, dashboard. The dashboard is that portion of the CHAS application suite saying how do I want to look at my data after I selected all those applications. And you can select some more widgets, and they're called widgets, or what I call them modules. And Mr. Keith, my notional instructor, will walk us through. And he's going in the upper right hand corner on the dashboard toolbar. He's going to go to add, and he's going to add some more module units. He's going to select a few in the highlighted yellow area of the add buttons. And he can add some or all of those module units that he feels he needs for good patient care. And he's going to close out the unit here by clicking on X. Okay, now, he has a one-column view here, okay, and he's got all his module units that he selected. Now he can adjust the way he looks at this information. So he's going to go to the Portal Dashboard toolbar, click on the Edit button. And you notice there are several page layouts. And he's going to go all the way down to the three-column layout and click Save. And we'll change his view from one column to three column. At this time, he can grab each module unit in the blue bar. Oh, Mr. Keith changed his mind. He wants a two-column view. When he attempts it, he's going to go to Save and say columns must be empty. That means he still's got to stay with a three-column view. So right now, Mr. Keith is going to go ahead and move all the module units by clicking and holding and putting them into two columns. Now he can go back, hit a two-column view, and click Save. And now he's back to a two-column view. He is happy. At this time, Mr. Keith is going to demonstrate the collapse and expand button for each module unit. You can take that little up and down button and collapse it or expand it, either or. And also, he's going to take referrals from me, and he's going to open that little module unit. And he can see all referrals almost in full screen. Now, Mr. Keith is done with radiology. He's going to click on the X button. And he got rid of those module units. So it doesn't matter if he does, because at any time he can always go back to the Portal Dashboard toolbar and click on the Add button and add those units again. Okay, so I'm going to go ahead and do that. Click on my dashboard. And this is my dashboard. As you can see, I have several module units in here. Some are collapsed, some are not. But I'm going to edit. I do not want some of these. So at this time, here's what I'm going to do. I'm going to say referrals from me, I don't want. I'm going to click on my little X box. I do not want patients seen in the last 365. I want an X box. Patients overdue, X box. ICD-9 code, X box. Now, if I want to bring information in this empty area, I can left click and hold and drag and drop. Left click and hold, drag and drop. Alright, now that's how you can adjust your two-column view. If I want a three-column view, go to my Portal Dashboard bar, click on the Edit, and I'm going to go to three-column view, Save. Now my portal dashboard is how I like to view it, 3 columns. So I'm going to left click and hold and drag and drop. Now I have 3-column view. Now this time I'm going to go hit edit button on the portal dashboard bar. I stand corrected. I'm going to add. And I'm going to add the following. Let's see, referrals to me, recent ER, PRT reviews. And now I'm going to hit the X box on that menu box, and it's going to refresh. And those things I just added are now part of my view. Left click and hold and drop. And there we are. That is how you would adjust your dashboard. Okay, any questions thus far? Alrighty, let me get back to my slides. Okay, searching for patients. One of the last things we want to do. This is a very easy way to search patients. And as Mr. Keith, my notional instructor, is going to demonstrate, and we show us how to search for patients. He goes to apps, appointments, and he's going to put his pointer inside the box. And the box says either by patient ID, name, social, or initial and last 4. That's how you can search for your patient. At this time, Mr. Keith is going to go ahead and put in a patient name, comma, last name. Now, just like in CHS, no dead space between characters or the information will not come up correctly. Now he clicked on Go, and he brought up a list of patients named Bush. So Mr. Keith selects the number 2 patient in the patient name column and brings up her information, which being last name, comma, first name, where she lives, her social, also her enrollment, also her age, sex, and date of birth, phone numbers, category, ranking category, and that's how easy it is. Okay, at this time I'm going to go to my appointments, click on appointments. My view is going to change, and now I am in my appointments unit or module. I'm going to look for one patient. All I know is, and I remember as a provider, that my patient's last name is Pace. That's all I remember, and thus I put in that information. Once I enter it in there, I'm going to click Go. And CHAS has brought me some information. Obviously, there's more than one patient named Pace. So I do remember that full name was Pace Aaron. Someone could click on this blue term with the underline on it. CHAS is right now bringing up that information. And as you notice on my dashboard, I have her last name, her where she lives, her social, who she married to, what enrollment, age, sex, date of birth, number. And that's how easy it is to search for a patient. Now at this time, ladies and gentlemen, any questions? Okay. All right, this is the ACE portal. And if you go to this ACE portal, it has a lot of good information, documentation, and also manuals for whatever application you're working on. I specifically took the page and copied it to this PPT, so that way you can see that I selected CHAS, what kind of documentation I could find and research. And also, if you notice on the right-hand column right here, you have post name. These are your CHAS site portals. It will take you directly to your MTS CHAS site, so that if you belong to Fort Jackson, Leonardwood, Irwin, you can go directly there, log in, and register for your CHAS account. There again, let me reiterate that you must have a CHS account with the proper security keys. Okay, Air Force CHAS video tutorials. The Air Force have this web link here to where you can go and view the videos. And it's a great site to learn if you're new to Carepoint Healthcare Application Suite, because it goes from the beginning all the way down to advanced features. Great site to go and do some research and go through some training. Any questions? Okay, let me reiterate. Okay, during the past few minutes, we covered the following items: how to go to a CHAS portal and register, how to set your applications, how to map your permissions, how to personalize your dashboard, and how to search for patients. And also one more thing, where to get good reference material and or documentation, so that way you can do your own research within those applications. Like again I said, the ACE portal is a great site for you guys to go to and research material, and also documentation for documentation of the applications. All right, and any questions at this time?
This is Michelle McCormick. I just have one comment before we close the session. So if, for those of you inside the DCO looking, there is a file share pod at the lower left-hand corner of your screen, and the document that I've loaded there is the Carepoint Security Keys PDF. So feel free, click on that document name, and that should prompt you to download, and you can save the document to your local machine. Those are the keys which Richard referred to throughout his session that provide access to the various applications inside of CHAS based on the keys given out of CHCS. So if you have any questions, feel free to email us. That's all I have. Thanks, Richard.
No problem.
So one final comment, if there's anybody else who is actually sitting around someone's machine and you're not logged into the session, if you would just include their name inside the chat pod so we can be sure and track attendance, I'd appreciate that. And I guess we'll see you next month. Thanks for your participation.